Hi everyone, today we are going to be talking to Kristen, who is a physical therapist, and learning a bit more about her job. My first question for you is, other than your degree, are there any other recertifications or classes required for your job?
Yes. So you need to have a certain amount of continuing education credits each year to renew your license. At this time, I think it's around 20 CEUs a year. So, but usually it's not a problem because in physical therapy, you're always kind of learning and growing, and you can take classes in whatever you want for your CEUs. So like, for instance, I have training in LSVT, which is a Parkinson's program. So that's one that I took. I'm actually getting ready to take my Graston certification. So that's where you're using tools to work on muscles. And then craniosacral therapy is another one that I've taken. So it's kind of nice because it gives you a chance to sort of refresh your skills and learn something new. And you can do it in whatever you want. So it's nice because you can choose areas that you're interested in.
That sounds fun. Was there a moment when you knew that physical therapy was the career that you wanted to go into?
Yes. So physical therapy is actually my second career. I was a writer first. But the thing I didn't like about that is I had to sit all the time, which is very hard for me to do. And then I actually had a pretty significant knee injury. I fell and had to have surgery. And I had physical therapy after that. And going through that, that's when I knew that I wanted to go to school and make a change and help people.
So what was it like to start out in the field? Obviously, you've gone to school, now you're a physical therapist.
It's interesting because when you go into physical therapy, you do a number of clinical rotations as a student. So the nice thing is when you're starting out, you know that you don't know as much as everybody else, but at least you've had the opportunity to work in different clinical settings as a student where you're not expected to be perfect. So it's nice. It gives you a chance to work with different people. It gives you a chance to work in different settings. So when I started out, I was so happy to be done with school that I was just very excited to be, to finally be working. But I think anytime you start out in something, you're still learning. And I've been really fortunate to work with really good people. So I never felt like I was alone when I was trying to start out. Does that make sense?
That makes sense. That's good. Yeah. It's nice to not feel alone. It can be scary.
It is. Anything new is a little scary. So, but that's very normal to feel that way.
So walk us through a day in the life of your job before COVID and working virtually.
Well, so strangely, I have actually worked even through COVID. The telehealth does not work well with physical therapy and what I do. So I have actually worked in the office. I have a little, especially when it was crazy, I had less patients, but I was still working in the office, just with a few more. We always have to take protocols, but just, we're more careful, I guess, now. But anyway, so my day usually starts the night before when I take a look at my schedule and I look at what it looks like, who my patients are coming in, and sort of what their needs are. So I take a look through and I do my planning for if someone needs a progress note, if I have to plan something specific for someone, if we're kind of moving up and we need new challenges, I sort of think about those exercises. If I had somebody who needs certain equipment for their session, that I make a note that I need to have that. So that way when I go in the morning, my day is kind of set for me. And that's, not everyone has to do that. I just do that for my own organization because I feel like that way when I'm working with people, they have my full time and attention. And I'm very fortunate in where I work that I get to see one person at a time, which is really kind of a luxury now in physical therapy. So when I go in, I open up my computer, I get all my medical records, open up for people, and then and then I just start treating people. So I go along, I work with people depending on what they need. They may need exercises, they may need more manual work, they may need gait training. So it's interesting because every hour I'm doing something maybe completely different. And I love what I do, and I love my patients. So it makes my day go by really fast because I'm interacting with somebody new pretty much every hour. As I'm doing this, somebody may come in, they may have more pain, so then maybe I have to throw the plan out the window that I had and deal with their symptoms and do what I can to help them feel better. They may be doing great, and so then I sort of progress them in between patients, or if I don't get it done in the day, then after I'm finished with everyone, I have to do their documentation. So each patient has their own sort of electronic file. It's our electronic medical record. So I go in there, I put in all the notes for, basically like how the patient is doing, what kind of things we did in the session, where I see they're getting better, where I see they still need help with things, documenting anything that happened, a fall or a new injury, anything like that. And then doing all the billing coding, which is really important for insurance. So I do all that. I do progress notes that I have to do. Sometimes I have to write notes or letters to doctors, or maybe I have to call like an orthotist if I'm going to send them for a brace or something. So I'm trying to think what else. That's pretty much it. And then obviously in between people we're really cleaning things because we have to we did that before COVID, but that's part of it now. So I think that's pretty much what my day looks like.
Sounds like a busy but rewarding day.
Busy, you know what? It's busy, but I love it, and it goes by really quickly. And I like to be moving, so for me, it's perfect. If someone likes to sit at a desk all day, it's definitely not a job for them.
Definitely. So what is the most rewarding part? Is it working with all the patients or something else?
Oh, so absolutely. So the patients are the reason that I do this job. I in general, I love people. I love to see people get better. It's so rewarding for me when somebody has either pain or something that they couldn't do, and then we work together and they have a plan that they can do at home, or they get better. That is definitely it's the best part of the job.
Is there anything that's really challenging, and how do you overcome that challenge and keep going?
So I will say the two challenges are, number one, paperwork is always a challenge, but it's part of the job that you have to do because it's important for the insurance part of it. So you just kind of have to plug your way through that. The other challenging thing is when you get somebody that is in physical therapy, but they don't necessarily want to be there, or they have maybe not a great attitude. And it's challenging to figure out how to get through to that person and how to have them understand sometimes that they have to, that they really need to do their exercises, or they need to do certain things at home to help themselves feel better. So it's that sometimes it's challenging, but it's can turn into a reward when you figure out a way to motivate that person and kind of get through to them and connect with them. So
my last question for you is, do you have any advice for teenagers who are interested in following your career path?
Yes, so definitely, if you are interested in this kind of career path, you want to take either in school or in college when you get there, anatomy courses. You really want to know a lot about the human body. So anatomy courses, all your basic science courses are important. Physics, is an important class. You'll actually take that in school. But if you're interested, that is definitely the way to go, is to really kind of focus on those science courses, because you've got to take those to get through the program. Other than that, it's a great, a lot of times students, if they're interested, they should definitely contact like a physical therapy clinic and just ask if they can either talk to the therapist or if they could come in and observe for a couple of hours. It's really a great way to see what therapists do, because there's so many different environments. You can work in the, like me, I work in a private outpatient clinic, but you could also work in a hospital. You could work in a school. You could work in a skilled nursing facility. Like there's many, many different environments to work in, which is nice, because I think if you're interested in therapy, there's so many places you can go with this career. So that would be my advice.
Thank you.
Thank you for watching this week's episode of Occupation Connection. If you enjoyed what you saw, make sure to click the subscribe button, hit the like button, and leave a good comment below.